Welcome to the Bonafide Reformer, Episode 5. Time to reform the CQC. It seems we are, once again, witnessing the time-honoured tradition of a government-commissioned review exposing the failures of the Care Quality Commission, and predictably, nothing much will be done. The Dash report, released in October, follows a long line of scathing evaluations that reveal the CQC's systemic ineptitude. Inspections collapsed, with just 6,700 conducted in 2023 compared to 15,800 in 2019. Hospitals, care homes and GP surgeries have gone months without oversight, and reports, when they finally do arrive, are months late and utterly toothless. And yet Starmer's Labour government has followed in the well-trodden footsteps of previous administrations by promising to somehow make the CQC more accountable. It's the same tired line we've heard in the past, from the likes of Blair, Cameron and May before them, a promise to slap a coat of paint on the sinking ship and pretend everything will be fine. But we know better, don't we? Let's not mince words. The CQC is a money pit. With an annual budget of $263 million, it drains taxpayer funds while delivering shockingly little in return. Worse still, its former chief executive, Ian Trenholm, walked away in June 2024 after 6 years of failure, leaving the interim CEO, Kate Taroney, to pick up the pieces. Taroney's appointment, while perhaps necessary, is yet another example of the CQC leadership crisis. Meanwhile, salaries at the top remain staggering. Taroney, alongside the rest of the CQC's executive team, enjoys a salary that's generously funded by taxpayers, with Trenholm as CEO pocketing over $200,000 annually before his departure, more than the Prime Minister. How is it that the leader of a failing, bloated organisation is better compensated than the person running the entire country? And then, of course, there's the mandatory Diversity, Equality and Inclusion Department, led by Jackie Jackson, another six-figure salary, this time for leading up a department that adds zero value to the quality of health and social care. The CQC's focus on tick-box diversity initiatives is yet another example of bureaucracy growing for its own sake. It seems that the CQC has mastered the art of looking busy while getting absolutely nothing done. This isn't a one-off. The CQC has been failing for years. Remember the Morecambe Bay scandal? The CQC tried to cover up its incompetence after allowing poor maternity care to go unchallenged, leading to the deaths of mothers and babies. Or how about its inaction during the COVID-19 pandemic, when it stood by while care homes became death traps? These are not isolated events. The CQC has proven time and again that it's not fit for purpose. The National Audit Office and Public Accounts Committee have both sounded alarms over the years, highlighting a lack of inspections, missed deadlines, and an utter failure to hold care providers accountable. It's no wonder that healthcare providers see the CQC as a bureaucratic nuisance rather than a serious regulator. It's time to stop flogging the CQC dead horse. I believe the best way forward is a hybrid national-local model where local regulators handle routine inspections and work directly with healthcare providers, while a national body sets the broader regulatory standards and ensures consistency. Imagine the efficiency of a system powered by AI and digital technology. AI-powered risk assessment could predict which care providers are likely to fail, allowing regulators to target inspections where they're needed most. Real-time monitoring through a centralized digital platform could ensure that both national and local regulators are always up to date, ensuring accountability. Reports could be automatically generated in days rather than months, providing actionable feedback to care providers immediately. Meanwhile, the public would have access to a digital platform that provides real-time updates on the quality of local services, empowering patients to make informed decisions and forcing providers to improve or face consequences. It's time for the CQC to be consigned to the dustbin of care history. Governments of all stripes have tried and failed to reform it, pouring more and more money into a system that simply does not work. Instead of continuing this charade, Starmer's government must recognise that bureaucracy for bureaucracy's sake is never the solution. A hybrid national-local model could offer an effective alternative, one that embraces the future, harnesses the power of AI, and puts the emphasis back on patient safety and care standards. The time for tinkering is over. The CQC has failed, and no amount of government platitudes will save it. Let's stop flogging this dead horse and bring in the real reform our health and social care system so desperately needs. Thank you for listening to The Bonafide Reformer. This article was first published on the 23rd of October 2024 on X at Noel Reforms.